Hey everyone, Dr. Ryan here, and in this instructional video sponsored by Colgate, I'll be talking about Optic White, its indications, contraindications, and proper use in the dental clinic. The information in this video will be relevant for both the at-home and in-office versions of this product. So indications for tooth whitening. Tooth whitening is one of the most popular ways to enhance your smile, but with so many options available, it can be hard to know exactly where to start with it. We'll explore the science behind tooth whitening first and how to achieve safe and effective results. So teeth can be whitened or bleached from the inside if they have had a root canal treatment, but much more commonly we're whitening teeth from the outside, called external bleaching. This is effective at removing extrinsic stains from things like tea, coffee, turmeric, red wine, smoking, all of those things. Or perhaps the patient just wants to achieve an overall brighter smile, and that's another indication for whitening. Now, hydrogen peroxide, or H2O2, is a mild antiseptic usually used on the skin to prevent infection of minor cuts, scrapes, and burns. But it's also a bleaching agent that releases free radicals when it comes into contact with water or saliva. These free radicals oxidize or break the chemical bonds of color-causing molecules in the enamel and dentin of your teeth, effectively bleaching the stains out. Of course, this will only whiten natural teeth, so it will not whiten dental work such as crowns, veneers, fillings, or dentures. So we do have a few contraindications that I want to mention for tooth whitening. The ADA recommends avoiding whitening while pregnant or nursing due to a lack of sufficient studies on safety during pregnancy and lactation. Tooth whitening is also not recommended for individuals with pre-existing tooth sensitivity because it can make their teeth even more sensitive. As we mentioned before, Colgate Optic White, like any bleaching product, won't whiten crowns, veneers, bridges, composite fillings, all of that. So it's important to keep in mind if you have extensive restorative work. It's contraindicated in individuals with any known allergies to any of the ingredients in the product, like hydrogen peroxide or sodium lauryl sulfate. Whitening should be avoided in patients with untreated caries, periodontal disease, or any other active oral health conditions. And lastly, it's not recommended for pediatric use due to potential risks to immature teeth. And as a general rule of thumb, no tooth whitening product should be used before a tooth pulp is fully formed and all the permanent teeth have completely erupted. Some other notes: irritation of soft tissue is most often seen when too much bleaching agent is applied and it leaks into and onto the gingiva. This irritation is usually temporary, and the good news is entirely avoidable. Sensitivity often occurs during the earlier stages of bleaching treatment. Again, that would be usually temporary and not harmful. There are a few cases, rare cases out there of irreversible sensitivity with tooth whitening, but most of those rare cases are linked to improper usage, like, for example, keeping the peroxide on your teeth for far longer than recommended. And regression of results is common after a few months and will require redoing the whitening treatment occasionally to keep the results to the level that you're aiming for. Next, I want to highlight the similarities and differences between these two often confused bleaching agents that you may find out on the market: hydrogen peroxide and carbamide peroxide. First, what's similar between them? Well, both of them release oxygen radicals that break down pigmented molecules embedded in tooth structure, effectively whitening your teeth. Both agents can achieve similar results, provided the concentration and exposure times are adjusted appropriately, and both are considered safe when used as directed. So that's the same. They'll both whiten your teeth and they're both safe. What's different? Well, take a look at the chemical structure. Hydrogen peroxide, or H2O2, is a very simple molecule, while carbamide peroxide is Yes, H2O2 with an added twist, though. It also consists of this molecule called urea, which is an inert component. The urea serves two main purposes if you're curious. It improves the stability and shelf life of the hydrogen peroxide, and it helps balance the pH. It makes it less acidic, more neutral, or even slightly alkaline, which minimizes potential enamel demineralization and tooth sensitivity. So here's a breakdown of the differences in this table. Chemical composition, like we just talked about, we have H2O2 here. Carbamide peroxide breaks down into H2O2 and urea, and the hydrogen peroxide component is about 1/3 of the concentration. So what does that mean? Basically, in other words, the conversion ratio between these two components is about 3:1. So a 6% formula of hydrogen peroxide is equal to 18% of carbamide peroxide, which will break down into 6% H2O2. Another example, a 10% hydrogen peroxide whitening agent would be the same as 30% carbamide peroxide, which would break down into 10% H2O2, and so on. As far as strength, hydrogen peroxide is more potent than carbamide peroxide. We talked about why, because the urea gets in the way a little bit. Time to effect. Hydrogen peroxide works quickly, often within 30 to 60 minutes. Carbamide peroxide requires longer wear times. It could be a couple hours or maybe even overnight for a weaker formula of carbamide peroxide. Duration of release. Hydrogen peroxide releases oxygen radicals rapidly, while carbamide peroxide works more slowly over time. Use in products. Hydrogen peroxide is found more commonly in in-office whitening. Carbamide peroxide is found more commonly in at-home whitening kits, although you can see these interchange with each other. Stability, the hydrogen peroxide is less stable, lower shelf life, degrades quicker. Carbamide peroxide, thanks to the urea, is more stable and has a longer shelf life. And then soft tissue irritation, higher potential for irritation of hydrogen peroxide due to the faster action and higher potency. And then carbamide peroxide, lower potential for irritation. I will say, theoretically, yes, this is true. In reality, there's not much of a difference in sensitivity. Honestly, the most important thing is that it's applied properly, not using too much, using a thin layer of whitening gel, and not keeping it on longer than described by the manufacturer. So let's talk through the steps of using Colgate Optic White. So number one, we want to prepare. So if you're using the at-home version, I'll tell patients you should charge the LED whitening device overnight, or at least 4 hours each time before you use it. And while it's charging, the power button will blink green. When it's fully charged, the power button will stay green. Next is to clean your teeth thoroughly. You want to clean them and dry them really well with a tissue or a paper towel or a cotton roll so that the plaque and the dental pellicle don't get in the way of the whitening. Next, if you're using the Optic White kit, you click this little pen here. You're going to click on the end of the whitening pen until a small drop of serum appears on the brush tip right here. This is what will actually whiten your teeth. The first use will take multiple clicks, up to 20, to get the first drop to appear. So don't worry if you're clicking a whole bunch, that is by design. Step number 4 is to apply a single thin layer of serum to each tooth that you want to whiten. And you'll wait for about 10 to 15 seconds for a clear coating to form. And this is the most important thing I have to say here. Less is more when you're applying with this pen. Less is more, and I mean that literally. It's alcohol based, so if it's applied in a nice thin layer, the alcohol evaporates and leaves behind a thin film of hydrogen peroxide. So 1 to 2 clicks of serum is plenty for up to 4 teeth. You do not have to apply a bunch of this serum. less is more. And also avoid contact with your gums during application to prevent unwanted sensitivity. Step number 5 is using the light. So once the teeth are covered, you can place the LED whitening device into your mouth and bite down gently. The idea behind the LED light, if you're curious, is to speed up the release of oxygen radicals, which are the things responsible for breaking down the pigmented molecules. It might accelerate the process slightly, but the peroxide agent remains the most critical factor in achieving optimal results. So if you just want to use the pen and keep the dried serum on your teeth, that's absolutely fine. Now, since this is a safe, relatively low concentration of hydrogen peroxide in the at-home whitening kit, that's only 6%, the dried serum can safely stay on your teeth overnight. You can even drink water, as the dried serum will not dissolve in water. The next morning, remove the serum by brushing as usual. And so this process that we just talked about, those 7 steps, can be repeated for 5 to 10 days, depending on your desired shade change. So that was the step-by-step guide for the at-home kit. The Colgate Optic White Professional in-office whitening kit utilizes a higher strength 10% hydrogen peroxide gel for teeth whitening. And with that kit, a barrier is provided to help protect the gums and isolate the teeth during the procedure. Otherwise, things are pretty similar. You still apply the whitening serum, you let it sit for about 10 minutes, and then you remove it though. What's different is you remove it with an ethanol remover pen. And that process, the in-office whitening, is repeated 3 times in one treatment to achieve an improvement of multiple shades. So here are some instructions for the patient. Since the product is alcohol-based, it is flammable. So you want to keep it away from heat and flames and do not use it while eating, drinking, or smoking. To optimize shelf life of the product, tell the patient to store it in a cool and dry area. Also tell them to avoid swallowing the whitening serum as much as possible. Some of it's okay, it won't be harmful, but if more than the amount used for whitening is accidentally swallowed, you tell the patient to get some medical help. You also want to avoid contact with your gums, your eyes, and avoid getting it on your clothing, since the whitening serum may discolor any fabric that it touches. So that's it for this video. I hope you found it helpful and informative, and I'll see you in the next one. Thanks so much for watching.